All right, welcome everybody to the Center on Child and Family Policy and Niskanen Center's joint discussion, Build Back Better, Flawed Agenda, or the Right Plan for Early Care and Education Policy. The Build Back Better Act of 2001 featured two early care and education programs described by the Biden administration as the most transformative investment in children and caregiving in generations. While the program did not make it into law, the legislation laid out a detailed blueprint of an increasingly influential vision for federal early childhood policy, and similar proposals have been reintroduced in the House and Senate. My name is Josh McCabe. I'm the Director of Social Policy at the Niskanen Center, and I'm joined today by a panel of esteemed experts to discuss the strengths and weaknesses of Build Back Better's early care and education proposal and the best path forward for federal policy. This panel includes Katharine Stevens, founder and CEO of the Center on Child and Family Policy, and author of A Flawed Agenda for Americans' Children, Build Back Better's Blueprint for Early Care and Education, which will be the focus of our discussion today. And she's joined by Patrick Brown, fellow at the Ethics and Public Policy Center, Natalie Renew, Executive Director of Homegrown, and Art Rolnick, Associate Economist at the University of Minnesota, and the former Director of Research at the Federal Reserve Bank of Minneapolis. We'll kick off with a presentation from Katharine, followed by a discussion from our panelists before opening up to questions from the audience at the end. You're able to ask questions either online or through the Q&A, and I will take those and aggregate them for everyone, and we'll have a great discussion today. So without further ado, I will turn it over to Katharine.
Thanks so much, Josh, and thanks so much for working with us to host this really important discussion. I am going to give, as Josh said, a brief summary of the kind of highlights of my report. I have a PowerPoint presentation, so I'm going to do share screen, and hopefully this will work. Okay, share. Do you guys see my my slide? Okay, perfect. Okay. So the first question people might have is, why focus on Build Back Better at all? Build Back Better is obviously no longer in play, but its early care and education provisions are still highly relevant because the legislation provides what's really a kind of a detailed blueprint of an increasingly influential vision for federal early childhood policy. For example, as many of you know, the Child Care for Working Families Act, recently reintroduced by Senator Patty Murray and Representative Bobby Scott, contains essentially identical legislation. So Build Back Better was, oops, sorry. There we go. So just a quick overview of the early care and Build Back Better's early care and education provisions. Many in the audience are probably familiar with these. Just quickly, it was in two parts. The first was the birth through 5 early care and birth through 5 childcare and early learning entitlement program, which aimed to improve access to high quality childcare for children from birth through age 5, increase the supply of high quality childcare, and strengthen the childcare workforce by raising staff wages and qualifications. The second component, which was somewhat smaller in terms of total funding, was universal preschool, which aimed to establish free universal pre-K for 3 and 4-year-olds, and aimed specifically to have that program run by the state and aligned more closely with the state's K-12 system. So overall, Build Back Better was widely characterized as building on the core strengths of the existing federal child care program, the Child Care and Development Block Grant, or CCDBG. The hallmarks of CCDBG are as follows. First, it has a strong commitment to state flexibility. So the federal government provides funding, states have a lot of latitude to design their state childcare program in the way they think is best. The second is a strong commitment to maximizing parental choice. And the third is the program is specifically aimed at to help lower income working families. So proponents have argued that Build Back Better considerably increased funding for early care and education while also continuing CCDBG's commitment to state flexibility and further bolstering its support for parental choice. But what does close analysis of the legislative text show? As I said, today I'm going to give you a quick summary of a 30-page report that Ms. Cannon Center recently published with my organization, CCFP, in which I presented my findings from a detailed analysis of the BBB's early care and education legislation. So all I can do in 10 or 15 minutes is give you highlights, but if anyone's interested, I would encourage you to read the report and actually, more importantly, read the legislation. It's impossible to really understand what legislation is going to do without actually reading the legislation itself. But here's my quick overview. So what my analysis found is that the devil is in the details. What those details show is that rather than continuing and building on CCDBG, BBB actually mapped out a striking departure from the existing program. And I argue in the report that it actually would have had multiple counterproductive implications and effects. So the first was it established an unprecedented federal role in early care and education. It would have given the federal government unprecedented control over state and local early care and education. It would have empowered the U.S. Department of Health and Human Services, or HHS in particular, to define, monitor, and enforce key aspects of early care and education in BBB-funded states, including minimum staff qualifications and pay, local provider prices, a range of what were called quality standards, and compliance with a number of complex HHS regulations. BBB would have reinforced and extended this federal control in particular by how it defined the funding mechanism for the child care program. So the existing federal child care program, CCDBG, is set up as a voucher system that largely provides funds directly to parents. But child care funding under BBB was defined instead as, quote, federal financial assistance to entities. As I explained in the report, this distinction might not seem important at first glance, but it's actually critical to the way the legislation would have functioned, because it meant that funding would go to providers rather than to parents. And further, that any provider paid with program funds would be required to demonstrate ongoing compliance with multiple additional federal laws and regulations, all monitored and enforced by a single federal agency, HHS. Second, this much amplified federal control would mean considerably reduced flexibility for states. And at the same time, the legislation would have restricted states' use of CCDBG's much more flexible funds for young children by requiring that BBB-funded states use no more than 10% of CCDBG funds for children under age 6. It also would have resulted in large new administrative burdens for states. I explain these in detail in the report, but as a top-level summary, states would have had to monitor all providers' compliance with a range of state and federal mandates, carry out ongoing quality ratings of every provider, conduct ongoing continuous quality improvement activities, help all child care and pre-K staff obtain additional credentials and degrees, license providers that were previously exempt from licensing requirements, actually develop new licensing standards, relicense previously licensed providers under those new standards, and actually administer the pre-K program across this the state. The third implication is a counterproductive approach to improving quality. Improving the quality of early care and education programs, especially for lower income families, is a crucially important goal. But BBB took what I think is the wrong approach to doing this. First, it would have been enormously expensive and largely infeasible in practice. That is, the gap between BBB's legislative mandates and on-the-ground reality was so large that achieving those mandates would have, in practice, been essentially impossible. Second, the approach that BBB took to raising provider quality was problematic in the first place, because it would have established and enforced a definition of quality that research has not shown to have actually any relationship to child development outcomes. Third, and most importantly, it wouldn't have improved the quality that matters to children and parents, which is children's experiences in childcare and the impact of those experiences on children's development. In addition, the unintended consequences of the mandated quality improvement control activities would, I think, have ultimately negatively affected provider quality overall. There's complicated reasons the nuance of this I explain in the report, but ultimately, I think it would likely have caused the quality of early care and education workforce to decline, and would also have been likely to increase the number of children cared for by each staff member, which is clearly counterproductive to improving young children's experiences in non-parental group care. Fourth, at first glance, BBB's childcare legislation did appear to provide strong support for parental choice. The legislation explicitly refers to a, quote, mixed delivery system and specifically stipulates that parents would use providers that they choose. How this system would have played out in practice, though, entirely hinged on BBB's very specific definition of, quote, eligible provider, which would, in practice, have substantially reduced the choices available to parents. So the bottom line is that BBB would have required states to use the federal government's definition of quality, not parents' definition of quality, and would have introduced a wide range of laws and regulations that would have ended up pushing a substantial number of childcare providers out of the market. In effect, what I argue is that the legislation would have shifted power from parents to federal and state governments. It would have promoted providers' compliance with a range of federal and state laws and regulations over parental choice. Fifth, the BBB was widely characterized as providing help for all struggling families and their young children. But what my analysis showed is that it would have disproportionately benefited more affluent families. CCDBG, the current federal child care program, targets government subsidies at families who earn under 85% of state median income. But BBB aimed to expand publicly subsidized early care and education to much higher income families, earning up to 250% of state median income, which in most states ranges from $200,000 a year to over $300,000 a year for a family of four. It's completely understandable that wealthier families would rather not pay for childcare, but unlike lower income families, they do have sufficient resources to do so. Surveys have also shown that higher income parents have a much stronger preference for paid non-family care. So what that means is that BBB would have, in effect, provided wealthier families with public assistance that they don't actually need for something that is of considerably greater value to them in the first place. At the time BBB was being promoted, the Congressional Budget Office had actually projected that over 40% of the nation's young children lived in states that were unlikely to participate in the program. This obviously reduced the legislation's total projected cost by billions, but at the same time, it meant that families in states that were not participating would be subsidizing childcare and pre-K for families in states that did. So the bottom line is that while BBB was widely characterized as providing help for all struggling families and their young children, many of the families it would actually have helped are far from struggling. And at the same time, the federal government officially expected BBB to do nothing for more than 2 out of 5 young children across the country. And finally, BBB was designed such that the families gaining the most financially were those who put the most children in childcare for the greatest number of hours per day, starting when their children were the youngest. Financial benefits also increased steeply as more of a family's children were in childcare instead of at home. What that means is that BBB would have established a substantial financial incentive for putting young children in non-parental group care, which is essentially putting the government's thumb on the scale to favor group institutional care over at-home family care for young children. So, what is a better approach? Improving the environments where young children spend their earliest years and helping parents balance work with raising their young children are crucial policy goals. But the fact that some families need more help paying for high quality early care and education does not mean that the federal government should be playing a central role in designing and running it. It also doesn't mean that our policy aim should be childcare for all. The specific problem we need to be solving is inadequate access to high quality providers for lower income children whose families must work for economic survival, so that those children have the same opportunity for healthy development that more affluent children already have. So I think there are 3 core principles that should guide federal policy making towards this end. The first is we should be directing public funds to the children and families for whom most is at stake. What lower income families need is enough money to access good care and education, not a huge federally controlled program that provides non-parental group care and education for all children under age 5. Federal funds should be targeted to parents who must work but don't have access to high quality providers for their young children. We should be helping families who can't pay rather than those who would just prefer not to. Half of America's children under age 6, 1/2 of America's children under age 6, live in families with annual household income under $82,000 a year. For these families, assistance in paying for early care and education can make a critical difference for their children, and that has to be our focus. Second, our goal has to be to expand and strengthen informed family choice. It's been widely argued that the childcare market is broken. But as the Center for American Progress has recently noted, the early care and education market does work in higher income communities. I think our focus has to be on how to make that market work too for the lower income families who need access to high quality care and education the most. And third, federal programs to improve child well-being have to reach children in all 50 states. When the design of a federal program neglects to address states' needs and concerns, the program just fails children in that state. So the bottom line is that programs that aren't intentionally designed for maximum state participation are essentially prioritizing the well-being of young children in some states over others. The existing federal child care program, CCDBG, is a strong vehicle for accomplishing all three of these crucial aims. Federal early care and education policy shouldn't replace CCDBG, but rather build on it by making it work better for the families it's supposed to serve. By first maximizing state engagement, so it reaches all children. Second, CCDBG subsidies currently reach only a fraction of lower income working families. And the subsidies that families do get are often insufficient to give those families access to the providers that more affluent families already choose. But that isn't a flaw with the program's fundamental design. Subsidies can be increased to a level that enables lower income working families to choose and access the providers they decide are best for their children. This approach will provide much needed help for the families who currently don't have access to high quality early care and education. And at the same time, it will increase the supply of high quality providers by driving more robust competition in the preschool market. So the ultimate aim of my report is to promote better informed and constructive debate about how federal policy can best advance the well-being of children and families. So I am especially excited to be engaging in this conversation today, and really grateful to the panelists who are joining us for their input on these really crucial questions. Thank you.
Thank you, Catherine. So now we'll open it up to get feedback from each of our panelists. We'll go in alphabetical order and start with Patrick.
Great. Thanks, Josh. And thanks to Niskanen for helping put this on. Thanks to Catherine for writing a great report. And I feel like my job is pretty easy, because all I really need to say is, like, I agree, and we can move on to the next panelist. But in the interest of making the most of my time with you all today, I'll just share a couple things. I don't want to amplify basically a lot of what Catherine's already said, and I do want to give credit to Build Back Better and the architects and the people who put a lot of effort into try to get it passed. I think it was a very useful exercise in thinking what a full-fledged vision of early childhood looks like from folks on the left. And I think, you know, coming from the center right and you know, a lot of my friends on more conservative circles, I think it's a challenge for us to be thinking, okay, we've seen what the left has to offer, and you know, where some of the blind spots are. It's sort of, when you hold up something to the light, you can kind of see where the cracks are, the imperfections. I think the Build Back Better exercise and Catherine's expert dissection of it in this report is useful for us to be thinking about, you know, where our own priorities are and what mistakes we can avoid in the future. But obviously, I think her report does a great job of highlighting where some political choices and some ideological blind spots and some just unthinking biases that we all carry sort of crept into how Build Back Better was designed and how it would have been implemented if it was enacted into law. And I think, you know, she touched on some of them already. The sort of I think unthinking assumption a lot of advocates kind of tend to make when we're talking about childcare specifically, that we need to be expanding, you know, our sort of modal experience in childcare is full-time center-based care. And we know that that's not the case, and that's not what families want, especially, you know, non-college educated parents, minority parents. In poll after poll, they tend to exhibit a much stronger preference for things like family-based childcare, relative provided care, nonprofits, church provided care, those kind of things that I think we kind of in that little shift that she talks about from, you know, the CCDBG model of effectively a voucher for parents to this sort of more regulated approach, I think, does a disservice to this idea of pluralism in childcare specifically. But also another blind spot that I think is sort of implicit in a lot of her report, but I just want to shine a light on it, is the fact that I think it's very clear when they were compiling Build Back Better and the different provisions they were putting into it. The childcare section was written by the childcare folks, and the universal pre-K section was written by the folks who were very involved in UPK, and we had a lot of debate over the child tax credit and whether that should be expanded. All these things were running on simultaneous tracks, but never really meshing in a way that treats early childhood as a continuum or as a spectrum. And that's why you saw a lot of concern that the massive expansion of federal subsidies in the childcare market were going to distort things, and certainly universal pre-K, if states had adopted that would have also impacted the market for childcare. These things interact in ways that massive reforms aren't very good at predicting. And so, I'm, as a conservative, I'm a little more Burkean in my approach, and thinking it's better to, as Katharine's talking about, thinking about ways that we can be improving CCDBG rather than just throwing the baby out with the bathwater in this idea of the market being fundamentally broken. I think that's probably one of the biggest disagreements between right and left on this. I really appreciated Katharine's point about the sort of horizontal transfers, both between parents and between states. And I think that's key for any discussions going forward. I think, conservatives in their rhetoric against Build Back Better, you saw some, I'm remembering Senator McConnell most notably, but others talking about how, sort of taxing some families to pay for benefits for others is not a really equitable principle if taken to its logical conclusion. And certainly, as our fiscal situation in the U.S. has deteriorated over the last couple of years, we're going to talk about high inflation, high interest rates, rising deficits, the trade-offs become that much more painful. And so if we're going to be thinking about early childhood on this spectrum and thinking about parental choice and really making choice meaningful for parents, we have to be thinking about, what is every dollar is precious, and even more than it was when Build Back Better was being considered. How can we be doing this in a way that maximizes parents' ability to find the care situation that they need, freeing up the supply side of the market when appropriate, getting rid of some of these regulations and regulatory barriers. I was reading about Austin's zoning reform around childcare and home-based childcare. I think those are kind of the things we need to be thinking about, but also just again, this idea that, especially, I don't, I would argue we didn't have the money then, but especially now, anything on the scale of Build Back Better, I think is pretty much politically non-viable, at least for the foreseeable future. And so getting back to some of those principles that I think left and right can share, that I think Katharine's talking about in her presentation, and I think a lot of the people who were behind Build Back Better would agree with, meaningful parental choice and recognizing the diversity and heterogeneity of parents' preferences, I think can help us find a way to an approach that isn't Build Back Better and maybe isn't the sort of libertarian utopia of some on the right, but borrows from the best of both camps. And I think that's where I hope to see the conversation going forward.
Thank you, Patrick. Natalie.
Thanks, Josh. Thank you, Katharine. It's really a pleasure to be with you today. I want to share a little bit of background about the work we do at Homegrown that informs my reactions to the paper. I really appreciate the paper and the opportunity to speak to it. Homegrown is a collaborative of funders focused on improving access to and quality of home-based childcare. We use the term home-based childcare to be inclusive of both family childcare, the regulated form of this care, where a childcare provider cares for 5 to 8 kids in her home, and family friend and neighbor care, care that's exempt from regulation, where relatives and community members care for 2 or 3 children in their home or in the home of the child. Homegrown launched because despite being the most prevalent form of non-parental childcare in this country, operated by dynamic small businesses, home-based childcare is largely absent from research and policy conversations and sees very little public or private investment. We support programs and policy efforts in 32 states across the country, reaching about 12,000 childcare providers who serve about 30,000 children. And we primarily focus on strategies that situate home-based childcare providers and the families they serve as designers, implementers, and decision makers in the early learning system. Today, there are 5.2 million home-based childcare providers caring for 12.3 million children under the age of 13, including 6.4 million children ages birth through 5. This is the most prevalent form of non-parental childcare in this country. Our coalition is inclusive of diverse geographies and communities across the political spectrum. Home-based childcare is present in every community and used by families at every income level. Home-based childcare is, however, more likely to be used by parents of babies and young toddlers in rural communities and among families who work non-standard work hours. Again, parents want their really small children in the small setting of the home with trusted caregivers who they already know. 30% of the infants and toddlers in our country are in home-based childcare as their primary arrangement, compared with just 12% in centers. In rural communities, while children in these communities are just as likely as their peers in urban communities to use childcare, they are far more likely to be in relative or other home-based childcare settings. And among families who work non-standard and non-traditional hours, this is where care is available. So 82% of unpaid home-based providers and 63% of paid home-based childcare providers are caring for children under the age of 6 during non-standard hours, compared to just 8% of centers that can meet that non-standard hours need. But we also know from families and some great research that the Urban Institute has done that families want their children in this setting during those non-traditional hours. So I'll sum it up with a quote from a provider in North Carolina who tells us about who she serves. She says, "I have a dad who's the CEO of a big company and a single mom who's the janitor at that same company. I have a registered nurse and a FedEx truck driver among my parents. Every one of them needs to work and needs to know that their child is safe and learning." Homegrown convenes a provider working group of providers across the country to inform our policy approaches. We work together to understand, address, and imagine a well-functioning childcare system. In this group, we are not likely to discuss the theoretical or conceptual issues that might animate a conversation in Washington, D.C., but rather the realities of this sector. And together we work on issues such as childcare regulation, professional development requirements, securing basic needs for the workforce, and ensuring providers are reimbursed for the meals they provide to young children in their care. These relationships and insights inform our federal approach and our thinking on Build Back Better and the subsequent legislation. As we consider the current state of childcare, we recognize that there is in fact a market failure, and it is clearly understood by both parents and childcare providers. Simply put, parents cannot find and afford the care they want and need, and childcare providers are earning poverty wages. For the small businesses who we call home-based providers, providers are managing multiple regulatory systems and performance expectations while being paid the little that parents can afford or the state reimburses, and often are relying on their personal finances to keep their businesses afloat. Homegrown endorsed the Build Back Better plan and the subsequent legislation called the Child Care for Working Families, introduced by Senator Patty Murray and Congressman Bobby Scott. And while it's not perfect, and there are areas we would hope to see improved in future iterations, we do believe this legislation is focused on this market failure and could have been a big first step to addressing the issue of parent affordability and provider pay. We are incredibly grateful to Senator Murray for her steadfast leadership on this issue and for offering a pace-setting piece of legislation. We were excited to see the expansion of family eligibility in the entitlement, the need for providers to be reimbursed at the actual cost of care, and the inclusion of licensed family childcare providers in the pre-K provision. Our major concern with Build Back Better, which both Katharine and Patrick raised, is that it did not include the full range of home-based childcare providers as eligible providers for the childcare entitlement. It only included a small group of providers who are already licensed and included those that are exempt from regulation and those who are not called licensed, but rather called certified or otherwise approved in their state. By excluding these providers from the childcare entitlement, we exclude a high number of families who need and prefer home-based childcare. The legislation articulated a goal for states to overhaul their licensing systems to be more inclusive. And I worry that states can, in fact, revise their regulations around licensing in the short period of time to make the program more available. We have good evidence that even in states where there are lots of resources and little political opposition to licensing reforms, that this is still hard to do and can take many years. Lastly, I will note that the legislation also articulated educator credentials and quality requirements that are not well supported, especially for home-based providers, who have largely been left out of the design and development of these programs to date. We know from providers that we work with that they are eager to engage in professional learning and to offer the highest possible quality to children and families. This professional support needs to accommodate their long working hours, often over 55 hours of care a week, be cost effective and not result in significant debt, be appropriate to their unique setting, and address the issues providers encounter in working with mixed age groups and children with special learning needs. Providers, along with higher ed institutions, training organizations, families, and other actors should determine how these systems and requirements look. As we look forward and imagine the system, we hope to see more good ideas emerge, and totally agree with Patrick that this has been an incredible opportunity for us to kick the tires and to think through what these things could look like. We hope that that conversation prioritizes access and affordability for families and improving compensation for the workforce. We believe there are many opportunities within the current system to both make improvements and create policy coherence that enables small businesses of home-based childcare to thrive, and that we need to make greater investments to address affordability for families while assuring livable wages for the workforce. We reject the idea that the current law and programs are sufficient but in need of some reforms, and we reject the idea that with more money, all will be well. There is an important need to make common sense policy improvements that enable parents to choose and use the care they want and need, and there is a need for increased investment to ensure those options are affordable and result in livable wages for the workforce. Thank you.
Wonderful. Thank you, Natalie. And now we'll turn it over to Art.
Thank you, Josh. And I really want to thank Katharine for not just this event, for her leadership on this issue for so many years. She's quite a force. Thanks, Katharine. So I want to start in my comments by defining the problem, at least the way I saw it 20 years ago when I got into this space. I was at the Federal Reserve. I used to worry about interest rates. Now I worry about babies. I worry about banks. Now I worry about babies. And the problem, the way I would define it, is the achievement gap. And that is children born into poverty. Generally, a high percentage of children born into poverty start school way behind. And we know when they start school way behind, the research shows on average, they don't catch up. And when they don't catch up and they don't succeed in school, there's a huge cost to that child, to that family, and to our communities. To me, that is the problem. And the reason I want to stick with that problem, and it has a lot of advantages in thinking through the issues we've been talking about, in particular, what would we view as success 5 years from now? And I'm going to say success, given the way I've defined the problem, is that a much higher percentage, not 30% of the kids, but 90 to 100% of these kids start school ready. And we should hold all these programs accountable for making sure that children start school ready. And I talk about it as early childhood development. So school readiness implies that the children are healthy and ready to learn. And this is not rocket science, guys. Teachers day one know when children walk in and haven't been through a high quality program or haven't had very engaged and empowered parents. Okay, that's the problem. Now, in looking at Build Back Better, I want to focus my remarks on what science says, what science tells us about the engagement. Now, I'll give credit to Build Back Better. Science is very clear. This country and our economy way underinvests in high quality early child development for most at-risk kids. They made that clear, I think, and I'm glad they put that on the front burner because it leads to discussions like this. Okay, so what does science say about how we should attack the problem about the achievement gap? Well, there are five challenges. One is, we commented on this, but here's where Build Back Better fails. Start early based on the neuroscience and based on the economics says we start prenatal. And that means we have home visiting nurses. There's lots of research to show it's very effective. You get a home visiting nurse, a home visiting mentor working with the family. Child is much more likely to be born full weight, full term, not addicted. And it's critical for the development of the parenting as well. So these parent mentors should have been part of that program. To my understanding, it was not. So first challenge is to start early. And I talk about early childhood development, prenatal to 5. Words like this have been used as second challenge, parent empowerment. Parents are critical. The science, I should mention, one of the reasons the science points to start early is the neuroscience. The neuroscience tells us brain development starting at prenatal is critical. These are critical years, the early years. We need to have those parents empowered and engaged, and that parent mentor really helps. So we need to empower the parents, and the way we suggested to do it, which is very straightforward, is a parent mentor along with an early learning scholarship. A scholarship that a parent can use at a high quality, I'll get into that, a high quality early childhood program of their choice. And it could be Montessori, it could be faith-based, it could be Head Start, it could be public. It could be family-based programs. We need all hands on deck if we're gonna make this, if we're going to significantly reduce the achievement gap. So start early, parent empowerment. I mentioned quality. Build Back Better, I think it goes way too far in trying to regulate quality. My looking at this issue, recognizing quality is very difficult to nail down. It's difficult to nail down in K through 12, even in higher education. But one thing we can do to assess quality for these early childhood programs is to look at outcomes. And the outcome is, does the child start school ready? We have assessments to decide that. In Minnesota, we've had these assessments for years, but almost every state has something like this. That, in my mind, is critical for the outcomes for identifying quality. Yes, we want safe places, we want high-paid quality teachers, et cetera. But ultimately, I want to judge a program, and I want the parents to know, if they look at a program, how successful that program has actually produced school readiness. That's the product, that's the outcome. So start early, parent empowerment, high quality based on outcomes. And as far as I can tell, that Build Back Better really fails on that aspect. They want to micromanage these firms, and I think that would be a disaster. Then targeting. Here, the science is very clear again. Science is clear we need quality. Science is clear we got to empower parents. Science is clear we got to start early. Science is also clear, and this is not just US evidence, this is international evidence. By far, the most success, by far, is with children born into poverty. Once you get significantly above the poverty line, there is no return. These kids that come from middle or upper middle class families, they're going to do well. They're not the ones that drop out of school. They're not the ones that fill our prisons right now. It is the kids born into poverty that fail in school. That's where the big return is. After that, the return is very little. In fact, the return that we found when we looked at a number of longitudinal studies, there's an 18% inflation-adjusted return when the public invests in children born into poverty. There's virtually no return once you get over middle class. So it makes no sense, given limited resources, that we don't target our most at risk, and we know how to do that. It's fairly straightforward. Okay, so start early, parent empowerment, quality, target. The last one is the need to scale. So as I mentioned with targeting, Build Back Better talks about universal 3- and 4-year-old. That's a huge waste of money. And we're not going to get all that money anyways. It's sustainable. We have to target the most at risk. But so how would you bring it to scale if you don't do universal? Actually, mentors and scholarships are fairly easy to bring to scale. This is not hard to do. We're doing this in Minnesota. Back in 2015, we got $70 million to fund what we call the Minnesota model, which is scholarships and parents. And we're serving about 15,000 kids now. We just got another huge amount of money to double or triple the number of kids over the next couple of years. One of the reasons we got this money, the success we had, we have results. we show that historically our children born into poverty, maybe 30%. In some neighborhoods, only 15% start school ready. We now have our programs, and some of them are some of the most poverty communities in Minnesota. We have 90% of our kids starting school ready. Our teenage moms, our kids are born full weight, full term. Our teenage moms are not getting pregnant again. 90% of our kids are starting school ready, and they're healthy, and they have an engaged parent, an empowered parent. So that to me is what should be critical. And when I look at Build Back Better, again, I give them credit for, in a sense, acknowledging that we've way underinvested. But when you go into the weeds, as Katharine has done a great job doing, it's far from where we need to be. Now, I should warn, necessarily having the states do this, I would get it down more to the local area. Even the states can overregulate. And so I do think if you empower parents and get the local communities involved in setting standards and getting the word out, in my neighborhood, in a upper middle class neighborhood, the parents talk to each other. They know who the good schools are, who the good teachers are. I want this information coming from the community. So I really want to get it down to the micro level, if you will, and have the parents more engaged in learning about the programs and in letting other parents know. On our website, we have a rating system. We list all the programs in your community when you apply for a scholarship, and we let you know the criteria that we're looking at for quality. Ultimately, we're not quite there yet, but ultimately, we're going to let you know what percentage of the kids of a specific program start school healthy and ready to learn. Thank you for this opportunity, Katharine. Great discussion.
Awesome. Thank you, Art. And we'll turn it back over to Katharine for her thoughts. We'll have some time for discussion before we open up for audience Q&A.
So I think what strikes me is that for people like, for example, Natalie, many others who are on the front lines of this issue, there is such a terrible lack of resources in the system. It's an emergency, really. It's an emergency for families who are lower income families who are literally not able to access not even high quality care, decent care for their children. And it's also an emergency for the care and education workforce, which is earning literally poverty wages, and some large percentage of early care and education caregivers and teachers are on federal assistance programs as a result. So the situation is so dire and has been dire for so long, even as the brain science has grown, showing us how very important this is, that it's understandable that when a 100 billion program or 200 billion or 300 billion or 400 billion program is kind of put out there, people's reaction is, let's just get this money and worry about the details later. The problem with that is that unintended consequences can be terrible and often much worse than we anticipate. So with respect to Natalie's comments, I actually think that this were Build Back Better to have passed, it would have been ultimately a disaster for home-based care, a literal disaster. On the other hand, what home-based care is currently facing is kind of a disaster also, with just completely inadequately paid providers who are opening up their homes to children on the one hand, and on the other hand, families who as I said, 50% of young children in this country live in families earning under 85%, earning under $82,000 a year, which means, and a large percent are living in families who earn under $30,000 a year. So the pressures are gigantic. I want to mention that I had the great privilege of doing a podcast a couple of weeks ago with Art Rolnick, focus specifically on the Minnesota Early Learning Scholarships Program. And I encourage anyone who's interested in this to listen to that. Because what Art is describing is what you could think of as kind of a voucher system. In other words, it's something that is completely consistent with how CCDBG is currently structured. The difference is that there are local initiatives to be communicating quality to parents, which is essential for a functioning market. Parents need information. And the other thing that's essential for a functioning market is that parents have enough money. So if the difference between a voucher system, a subsidy, which of $5,000 versus a subsidy or a subsidy of zero, actually, in many cases, for their current program, or in a subsidy of, say, $12,000, is the difference between a functioning market and a market that's not working for lower income parents. One of the things that Art says that he explains very clearly in the podcast is demand drives supply, not the other way around. We think of supply, and I don't, if he has a minute to kind of elaborate on that, I think it could be very useful. If in fact families, low income families have, and this is what they found in Minnesota, have substantial subsidies, the childcare providers want that business. And one of the questions that's so crucial is, how do we increase the pay of the early care and education workforce? This is just a huge problem. If more money goes into the system via parents, that money will end up going to staff, because programs will compete by having higher quality staff. And a crucial part of having a high quality staff is that they are not on poverty wages. You don't have high turnover because people are so poor and they hate working there. So any childcare provider understands that the quality of their workers is the key issue for parents, and obviously, very obviously, for children. So if parents have enough money to pay for providers who are paying their staff or themselves are earning a living wage, that's what parents are going to do. So I think those are my burning
Katharine,
thoughts.
Katharine, let me jump in. I like calling them scholarships, not vouchers. And when our parents receive it and they see that somebody cared enough about their child to give them a scholarship, it changes their lives. And so words matter here. And let me say why. By the way, Katharine, you're starting to sound like an economist, so I'm worried. This isn't just theory anymore. We did a pilot study. We raised 20 million privately a number of years ago. And we gave out about 400 plus scholarships in a very low income area. And these scholarships paid up to $15,000 a year. So they were very generous relative to the market at the time, because we wanted, and it was brand new. We circled a low income neighborhood in St. Paul, and the critics said it's not going to work. They don't have quality programs in these areas. Well, when the word got out that we had over 400 families with scholarships paying that much money, within 6 months, Montessori expanded their program, faith-based expanded their programs, families expanded their programs, the public schools expanded their programs. And within 6 months, every one of our parents found at least a 3- and 4-star rated program that they could choose. So this is what we meant by demand. Demand will drive the market as long as you make a commitment. And I would say Build Back Better was an attempt to make a commitment to the providers that we're going to provide the funding. And notice, every dollar in scholarship went to a provider, whether it's home-based, whether it's public school, whether it was Montessori, whether it's faith-based. Every dollar goes into that industry. And that industry, as Natalie, I think, makes very clear, is way underfunded. This is a way to get the money in there, but through the parent making the decision. They're the ones that know what's best for them, not somebody in St. Paul, some bureaucrat making a decision as to what program should get it. Rather, let the parent figure this out. The only qualification we have is they have to pick a 3- and 4-star rated program. And there we have some issues, but like I said, we're moving towards outcomes. So our parents will know which programs really produce the kind of outcomes that we know are critical for this child to succeed. And I also should say there are some unintended consequences, but they're good ones. So we found that our parents, their self-confidence went way up. Many of them went back to school and went back to work. And another amazing thing that we found, this was in North Carolina on their program, when they aligned with high quality pre-K programs, they closed the gap by 3rd grade, and teacher turnover went way down. And teacher turnover goes way down because now you can teach to the kids. Now these kids are ready to learn. You don't have to deal with all these difficult problems when a child starts behind. So there's a lot of really good unintended consequences. And as you can tell, that's the model that I like. I've got the evidence. If you got a better approach, put it on the table. But right now, we're getting some really amazing results in Minnesota.
Great. We've got a good set of questions in the Q&A. Some have to do with raising wages of early childhood teachers and workers, and sort of where that funding might come from. So 2 questions. I'll synthesize. Do we see increased funding leading to increased wages for folks in these industries? And any thoughts on how states or the federal government might raise more revenue? Some folks have suggested estate taxes. Massachusetts did a millionaire tax. Vermont's done a payroll tax. New Mexico did natural resource tax. Any thoughts on how we might raise the revenues to raise wages for workers?
Sorry to interrupt one last time, but what we found in Minnesota when we did this pilot, wages did go up. We were paying $15,000 a year. We were demanding quality, and it did go up. Now, I'm not saying that's the only solution. I do like some approach to directly pay workers more, get them more incentives to get in the field and raise that wage. That's a more complicated system. I have no expertise on that, but I will say if your scholarships are generous, we have evidence to say that will move us in the right direction. I think that's a start anyways.
I'm happy to take a stab at the raising wages question. I'm not going to take a stab at the raising revenue question. I do think that increasing the amount of money in the field will improve wages, but we need guardrails on that, right? So I do think there are some interesting opportunities to target compensation directly to the workforce. So many states have workforce registries and opportunities to ensure the workforce can access income and benefits, which many in this workforce do not have. The field is primarily made up of small businesses who are making difficult decisions to keep their businesses open. And so I think unless there are some guardrails to ensure that those additional dollars are targeted at wages, then there will be inconsistency there. And I'm very empathetic. If you are running a center and your boiler breaks and you need to spend $10,000 improving your boiler and therefore cannot target those dollars to wages, like that's a very difficult decision for a small business to be in. So I do think we need to have policies that prioritize and ensure that additional investment is reaching, the workforce. And there are some states that are exploring ways to do that and making some progress.
Josh, I'll take a stab at where to get the funding, how to raise the funding for early childhood providers. Let's put off building another multi-billion-dollar sports stadium professional teams with public money and use that for a much better return on your investment. Now, a lot of people won't like me saying that, but let me tell you, you get a much better, these stadiums are going to get built anyways. These kids, if they don't get this advantage, they're going to fall behind.
And I'll just jump in there to say that, obviously most of that, to take that as an example, most of that stadium funding is coming from localities and states. And I think that's appropriate. You mentioned New Mexico, Vermont, some of these other states that have been experimenting with figuring out the revenue side. Now, obviously, who's the bank robber that said that he robs banks because that's where the money is, right? That's everybody's approach to DC. But as I said in my comments earlier, certainly the makeup of the Congress as we see it today isn't really in the mood for additional deficit spending, and I would argue neither should it be. And so, we have a federalist system in which states are able to experiment. That can be a little frustrating at times if you're talking about 50 different approaches, and certainly, ideally you'd find what works and scale it elsewhere. But I don't think it's I was kind of happy to see New Mexico pass its initiative. I think it'll be interesting to see how it plays out. And I think one federal approach that I think I want to learn from, that I think we're still trying to figure out where exactly all the money went, was in the ARP, the American Rescue Plan, where they basically gave states a chunk of money and said, go do with it what you want, more or less. We've heard anecdotes about what that's done, but I still think we need to see, what sort of impact that's made, and if there was states that were able to do creative things with that. And so, to me, that's almost a more interesting way of supporting the early childhood space, rather than trying to construct this parallel, in some ways competing structure on top of CCDBG that Build Back Better would have done.
Oh, Josh, I have a kind of a thought on this, which is, I think one of the things that, as Patrick, you said, is valuable about Build Back Better was putting this issue on the table in such a massive way. And one of the best things that can come out of it, is more attention on all sides of the aisle and at both the state and federal level about this. What I'm seeing is such what you could almost describe as a pent-up demand in the early care and education industry, if you want to call it that, as well as families who are having an extremely difficult time, especially lower income families, balancing earning enough money to economically survive on the one hand, and raising young children, their own young children, on the other hand. So I think that in our sort of polarized society, one of the things that I worry about is this sort of all-out war, where the instant that on the federal level, say Democrats are in a position of being able to get something through, it'll be a kind of a throw caution to the winds, worry about the details later, massive amount of money. Because there's this sort of binary thinking, like we're either stuck with nothing, because obviously, Patrick, we're $32 trillion in debt. This is an enormous problem. There are a number of people, one might argue not enough people, federal policymakers focused on this, but it remains the case. At the same time, if the Republicans don't step up to this plate, if they don't engage with this, and we spend a lot of money on a lot of things, wars most recently, but a lot of other things too. And this is actually a crucial issue for families. Nothing is more important to families than the well-being of their young children. So I think we could take Build Back Better, 400 billion or whatever it was, as almost like a thermometer of the sort of the boiling point of this issue. So to me, the way we're going to get through this in a way that's actually helpful to children and families is for the right to play a much more active role in thinking about increasing CCDBG funding, for example, along the lines of to turn it from subsidies, quote, to scholarships, say, targeting low-income families, and to be emphasizing a state and local partnership. So if the federal role was to really give poor families the resources they need to access high quality care and education, and at the same time incentivize states to step up to the plate, because states are also realizing that this is a problem. Blue states, but also red states, are increasingly interested in this, that sort of right, Republican, Democrat, state, federal, that if we could get those four all working, then right in the middle there, we could move forward in a way that we kind of like almost let some of the reduce the urgency of this, so that we can end up to something that's constructive, rather than something that is will cause more problems even ultimately than it solves, and that people will be sorry about later.
Katharine, just to reiterate, in Minnesota, we've had bipartisan support. The Republicans really have stepped up. And I would argue it's because we had accountability. We could show results, and we showed the science, and then we showed the results. Our kids are actually starting school ready and succeeding. And our parents, actually our family's income are going up because they're able to go back to school and back to work. So we're getting the kind of results that both sides can support. And so I don't, this doesn't have to be political. If we do it right and if we show it works. Now, the Build Back Better, I didn't see accountability there. And I want to stress, if we're like, I actually agree wholeheartedly with Patrick. I think at the local and the state level, they can do a great job with this, but they have to demand accountability. And so you have to define the problem carefully and what's going to be success over the years. And when I testify in Minnesota, I say, 5 years from now, if we don't have results, program's over. We can't show you results. So, but we are tracking, obviously we are tracking the results. And I think that's the way to get bipartisan support, to do something, as we all agree, is really important to do.
We've got a couple of minutes left. We had a few questions about the role of faith-based care centers or care in all of this. So we've talked about home-based, center-based. There's some controversy around faith-based. Do you guys have any thoughts on what that looked like in Build Back Better and what it could look like going forward?
Well, I'll just say that Build Back Better would have had a really potentially devastating effect on faith-based providers, because of what I had explained earlier. While CCDBG is defined as a voucher payment to a parent, the Build Back Better funding was defined as federal financial assistance to entities. And what that means is, while a voucher, a parent can choose, for example, if you want to send your child to a preschool in a church that also provides services and has Bible study and so forth, you can do that. But federal financial assistance can't be provided to an entity that also engages in religious activity. So those things have to be entirely separated. And the on-the-ground implications of that would have made it impossible for many faith-based providers to be eligible. And I would say that was a really good example of there's sort of a top line promotion, talking points for why this is a good idea. And there's the obvious, $400 billion additional dollars in this really sort of desperate social space is clearly desirable. And this is a good example of where the details are really crucially important. The Bipartisan Policy Center, some of you may have seen, put out a report a year or two ago showing that, in fact, of families who use center-based care, the majority prefer faith-based care. So it really, the design of Build Back Better in that respect was I think arguably disrespectful to the choices of a large proportion of families.
Great. We're nearing the end. So I want to give everyone a minute to give your final thoughts or burning thoughts before we close out here. So we'll go in alphabetical order again and start with Patrick.
Yeah, well, thanks again for organizing this. I hope it's been useful to everybody. I know it's been useful to me. And I think one thing that makes me hopeful for the future of this is that we've seen the failure of Build Back Better. I think sort of like a tree that falls in the woods and then sprouts a lot of, you know, other plants and moss and whatever that comes from that. We've seen, I think, a renewed rhetorical emphasis on these things that we talked about today: parental choice, real pluralism in our system, the recognition that not everybody is looking for a center-based childcare. Obviously, where the money comes from, you know, how these programs are designed, those are all big questions. But I think just, you know, when you look at columns from the Washington Post or Vox or any of these sort of mainstream media organizations that are recognizing that there's a part of the reason why Build Back Better failed to resonate, I think, was because it wasn't speaking to some parents who didn't see their preferences and ideas matched in legislation. And so to me, that's you know, we saw this in Boston, we saw this in a couple other places as well, where they're really leaning in this idea of incorporating as many providers into their system as possible. And I think if we can affirm that, I think that makes it easier to have that conversation about money and investment and that sort of thing.
So Natalie?
Thanks, Josh. Thanks, Katharine. It's really lovely to be with you all today. I think I agree. I think there's a really incredible opportunity, and I think Build Back Better has given us a lot to chew on. And even in this conversation, we've talked about some other mechanisms that could be considered. I think what's most important is that we share a set of priorities that families and childcare providers are articulating, which is, to my mind, clear, that families can find and afford the childcare that they want, that they need, and that affirms their goals for their own child thriving. And that the individuals who offer and provide that care, the small businesses that offer that care, are able to run a viable business in so doing. And then I think beyond that, the way we get there ideally is responsive to, listens to, and is designed by those parents and providers. And I think there are a lot of mechanisms that could be considered, some that we've talked about here, I think many others. But to my mind, with a clear priority, with deciding who participates in that conversation and really ensuring that parents and the folks who do this work are at the table and have a lot of power in that conversation, I think we'll have a better chance of getting to mechanisms that are workable, that are politically viable, and that we can hold communities accountable for. Thank you.
All right.
Yeah, well, again, great opportunity. Thanks again, Katharine. And I like Patrick describing Build Back Better as, you know, there's some shoots that are blossoming here and getting these discussions. So I hope we move forward on this at the national level, at the local level. I want people to think of early childhood development as economic development. I think bringing that notion into the political space, we're much more likely to get funding at the local and the national level. This is investing in human capital. It's critical. It was critical over the last 50 years. The next 50 years, not physical capital, human capital is so important for this economy. It's so important for these kids and these parents. And so it's a moral issue, and we can make it a moral issue. But I think when you get into political space, the really way to get that funding that we need, that we've all talked about, is you've got to make it clear this is economic development. As I already said, it's much better than building stadiums, where there's a lot of money that goes out there that I would argue zero return. This is a very high return, and we've got an industry there that I think is ready to really produce here. We've got to fund it.
Katharine.
I just want to thank you, Josh, for working with us to put this on, and for co-publishing the report, and to the panelists for reading the report and participating in this really important conversation. And I hope that I think we're all going to be using Patrick's metaphor. So I hope we'll find ways to nurture the little plants and trees and moss, as he said, that are kind of before us at this point.
Awesome. Thank you, everyone. And thank you to our audience. We had a lot of good questions. We couldn't get to all of them, but I like to think of this as the start of a conversation. So you can read Katharine's report on the Center on Child and Family Policy's website, as well as Niskannen's website. And I encourage you to check out the work of all our panelists here today, who are doing fantastic stuff in the childcare area. It's a vitally important area. So we look forward to continuing these conversations and making progress in the future. Thank you, everyone.